So, is drinking Dr. Pepper a great alternative for eating prunes? Let's find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you're a first-time listener, welcome. Please check out our library of podcasts. Over 300 podcasts out there.
350 podcasts.
Over 350 podcasts out there. That's right. And if you're a regular listener, thank you so much for always being here with us and taking the time. We greatly appreciate you. And so what about that?
How did this topic come up?
So one of the nurses at one of the centers I work at, she's
another one.
Yes.
They're just full of ideas.
They
for
are.
podcasts.
They are.
I love it.
And so it was just like a hallway conversation that was taking place. And I'm walking down and she's like, "Isn't that right, Dr. Cruz? Isn't Dr. Pepper made out of prunes? So it's good to drink it. It'll help you poop." So anyways, wow. I had no idea. I never even heard of that. Had you heard of that?
I've never heard of that.
Yeah, so I never heard of it.
Where do people find this stuff out?
I know, right?
Okay.
Right. Anyways, I never heard of it.
Yeah.
And so I told...
So if she thinks it, I mean, there's probably millions of people who think that.
Absolutely.
Yeah.
So that's why I
We're
told
gonna
Tina,
podcast
I
on
said, maybe we should podcast on this because I've never heard of it. And I'm curious. And we still don't know where that started. However, everything that we've read, the company definitely says no.
They've been denying it since
They've
the late
been denying.
1800s.
That's right.
Since they started.
Since the 1930s, was it? Or I mean, they've been denying that rumor for decades. And so
because they don't want it to be thought of as a
it's not hip.
Healthy thing, or
it's not hip. The connotation that comes with eating prunes is aging. Mm-hmm. It's pooping. Not a hip thing. Pooping, and so so they have denied that, and they say no, there's no truth to that.
Although the ingredients are hidden and very secretive.
They are.
Yes.
And the recipe is safe in a safety deposit box. Is that what they call it?
And there are 26 things?
In Texas. Because actually it was created by a pharmacist at a drugstore in Waco, Texas. Okay?
Very interesting.
Waco, Texas. That also has a lot of lore associated with it.
Actually, we learned that a lot of sodas were created by pharmacists.
Yes.
Which is very interesting.
Yes.
And they were actually initially intended to help with
ailments of the stuff.
Exactly. And things like that, which is very interesting.
Exactly.
Yes.
Especially since, especially now, most sodas have high contents of fructose syrup.
Yeah. High
fructose syrup.
Yeah, high fructose.
Okay.
Corn syrup.
Have large quantities of high fructose
Ingredients
syrup.
have changed over the years.
Yes. Ingredients have changed, though I believe, I don't know what the ingredients were originally, but I believe the original ingredients had sugar.
Right.
Okay. So lots of sugar. Supposedly, from the little that we were reading about Dr. Pepper, it is a concoction of several fruit juices. All right, several fruit juices. There's probably some vanilla, which supposedly vanilla is in a lot of the colas. There was even some thought that there may be amaretto to give it the almond flavoring.
Cinnamon.
Maybe cinnamon. Yeah.
But these are just people's speculations based on the taste
Exactly.
of it.
We don't know for sure.
The true recipe of Dr. Pepper is under lock and key, and nobody knows it.
Exactly.
So, but I just thought it very interesting that people thought there were prunes in Dr. Pepper and that it was actually healthy for you to drink Dr. Pepper, because there's nothing healthy about drinking any soda.
Yes.
At all, ever.
Yes. But it is pretty interesting and fascinating that a lot of these sodas were originally created by pharmacists. And again, it was, like Tina said, it was to help people with some of their digestive ailments. Now, the thinking is stay away from soda. Stay away from soda. I mean, sugar, high fructose corn syrup, natural flavorings, which is basically code for chemicals, and even diet sodas are probably even worse than regular sodas. All the chemicals.
Patients when I'm doing consults with them, they'll tell me like they're trying to lose weight, so they switch to diet soda, and I tell them absolutely not. Like, it's worse to drink a diet soda than it is to drink a regular soda, because yes, sugar is bad for you. But artificial sugar, which is in diet soda, is even worse for you. And then there's even more chemicals added to diet soda than there is in regular soda. So idea is try to get off soda, right?
Exactly.
That's the bottom line.
Exactly.
Because it is so harmful to the body, causes so many ailments, causes weight gain, messes up your liver. I mean, there's nothing good about soda.
Messes with your bones, okay? Osteoporosis. There's even been information out there about the potential for cancer. I mean, look, it can't be good for you because of all the chemicals in it and all the sugar. I mean,
and there's literally zero nutrients in soda.
Yeah, and
so
the high fructose syrup. High fructose syrup. I mean, that basically gets converted in the liver to fat. Okay, so it's not a healthy beverage. It's not a healthy beverage. And what we typically will tell our patients, I mean, we have patients who have told us that they'll drink easy a six-pack of whatever, Dr. Pepper, whatever the soda is, or even more, okay? We have patients who have told us through the years, when we ask them, do you hydrate? Yeah, absolutely. Drink a six-pack of this soda.
Or they think if it's a clear soda or if it doesn't have caffeine, that it's okay, right? Because, I'm going to drink decaf coffee, decaf soda. Again, still loaded with sugar. So yes, you're getting away from the caffeine, but you're still getting the chemicals, you're still getting the sugar, which is what wreaks havoc on the body, wreaks havoc on the liver.
Right.
So there is really no soda that's healthy for you.
There's not. And so what we tell our patients that are drinking soda, first of all, we tell them don't stop all at once, because if you just cold turkey stop, you'll be right back on it. You have to do it in baby steps. We tell them to start replacing a can with a bottle of water, and just gradually start to drink more and more water as they wean off the soda. And that's going to probably be the best way for them to actually come off of soda and stay off of it.
Yeah, I usually do the same thing. I encourage them to drink, one less soda, drink a bottle of water, do that for like 2 or 3 weeks until that gets really easy, and then do it again, drink one less. And the same goes for coffee. Honestly, if they're drinking a lot of coffee or specialty drinks like from Dutch Bros or Starbucks, just getting people to drink more water is so key to them feeling better. But yeah, soda tends to be one where people, they'll tell me, I drink water all day, but I have to have soda at night with dinner, or I drink soda when I go out, and I don't know, it's considered a special treat, I think, for some people, but drinking it like that every day, or when you go out on the weekends consistently, is just such a bad habit, and, can cause so much harm to your health, and it's such an easy thing to turn around your health, right? Just by stopping.
It may not be an easy thing to stop, okay? Because if you're addicted to it, it's just like any other addiction, okay? However, to what Tina says, if you're trying to look for
one thing
that you could do to improve your health, and if you're somebody that enjoys the sodas and drinks them regularly every day, that would be one huge thing that we would highly encourage you to try to start weaning off of. That's going to make a huge difference in your health. I mean, people, just because of the sugar contents, can develop diabetes, kidney issues, I mentioned bone health issues, osteoporosis, not to mention the irritation that it causes to the stomach. fatty deposits in the liver, because in the liver is where it's being converted into fat.
So many of our patients have fatty liver today.
Very
and
common.
when they're like, oh, what can I do? Because the cool thing about the liver is it's one of the few organs that can actually repair itself and turn around, right? And like heal. But you have to stop those habits, right? So they always ask me, what can I do to reverse the fatty liver? Like the easiest thing, obviously, you could do is stop drinking soda, start drinking more water, right? So that's a huge one for people, because so many people have fatty liver today.
So common,
for so many reasons, but primarily because of our intake of soda.
Yeah. Well, and junk food, sweets, the fancy coffees that are loaded with chemicals and sugars. All right. And so, we could actually go on, because I just thought of what your liver is doing when it is taking these fat deposits and tucking it away into the body of the liver, into the organ, and why people develop fatty liver. Your liver is actually trying to protect you. All right. These chemicals that we take in, that we eat, that we drink, that we breathe in, that we put on our skin, we're surrounded by toxins, by chemicals, and your liver is like a detox power horse in your body, trying to keep you healthy, trying to detox you on constantly. Okay. Every day. And so one of the ways in which it tries to protect you is by taking some of these toxins, these chemicals, and just kind of wrapping them up in a little bit of fat and tucking it in the liver.
It's pretty incredible, actually.
Yeah, it is. It's pretty amazing what your body does to protect you and to continue to work towards healing itself.
So do your body a favor.
Please, yes. Hey, listen, like I said, don't stop cold turkey, but just, if you're drinking a 6-pack a day, take it down to a 5-pack. Down to 5, and drink more water to replace that 6 can. And do that for 1 week. And then the next week, cut it down to 4. Okay, so just in baby steps. If it takes you 2 weeks, that's fine.
Even if it takes you 6 months,
that's right.
A year to come off.
That's fine. But just start working through it and do it. All right.
And Dr. Pepper does not have prunes in it.
Yes, according to what we have seen, there is no prune juice or prune anything in Dr. Pepper. So anyways, if you'd like to connect with us, please check us out. Go to our website, drlizcruz.com. There is a magenta pink button right in the middle. You can click that and schedule a free 30-minute wellness consult. And you can do that from anywhere in the world, because it is over the phone. And again, it's free to you. If you have not rated us, please rate us on this podcast. Give us a 5-star rating, because that'll actually help other people like you to find us. And lastly, if you have not subscribed to our podcast, please subscribe so that you do not miss any episodes. All right. Well, thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.